Hi, listeners and followers of health issues, and welcome to this poetic presentation of some misconceptions about dementia. It goes as follows: not a disease, just a condition anyone can have at some stage of life and live through rest of life. Not indispensable in elderly, not a normal characteristic of the human aging process, not a curse or a form of madness, not famla, not were, or whatever you may call it in your own setting. Abuse and despise not those living with dementia, for they are just living with the condition. They are not the cause of the dementia they live with. They are not sufferers nor helpless, as mistakenly labeled, not disabled nor a nuisance to others, the society, nor the community. They are human beings like you and I, with equality, and don't necessarily lack capacity, as many would think and take them. Talk to and include them, therefore, in all their care and plans, because they and significant others are vital sources of indispensable and vital information needed for the holistic, person-centered, and quality care planning and delivery. Not their wishes to be angry or offended by every little thing or chase a partner out of their matrimonial bed or home, taking him or her for an intruder or a stranger. Is nothing but just the dementia they are living with. Understand and consider the person and the dementia as two separate entities. Put and consider first as a specific person with unique characteristics, then the dementia separately, not associate the two or vice versa. We can all live happy and quality life with dementia, just if we understand what it is, just like other health conditions. We're just equal and normal human beings like you all, to be considered included in all facets of life, society, and the world at large. Because we are all humans that deserve equality, respect, and dignity. We are not things or things. These are some of the misconceptions that I intend to present in this presentation today, listeners. And it's just to highlight the fact that some societies tend to label people with dementia differently. They are given labels and attributes which are not typical of them. And these are principally because of the lack of the understanding of what the condition is. It is not a curse from the ancestors as mistakenly labeled. It's not, neither is it a form of madness. It's just the dementia, and it advances with time. As time goes on, dementia advances and can progress and degenerate into other presentations. It is therefore necessary to understand that the significant others and the person living with dementia, if they can still do, are important sources of indispensable information that is needed for the planning and delivery of quality healthcare to these people, especially when they are seeking placement into long-term care facilities where they will be needing assistance with activities of daily living and others. Memory lane reminiscence can therefore not be created without a good understanding of the story behind the person living with dementia. And we need to see the person as an entity and a personality different and dissociated from the dementia. So we need to see the individual and the dementia separately and not put the dementia first, as is a practice in some settings where the dementia is rather seen more conspicuously and considered first than the person and his personality or her personality. It is in putting all of these together, listeners, that we can have a quality care plan that will enable the care service provider to administer or to deliver quality person-centered care to the person living with the condition. They are not to be labeled in our societies the way they are being labeled. They are not handicapped. They are not disabled or people without value, as they are termed in our various settings. As we can testify this, we need to have a dementia inclusive society wherever we are, to be able to see people living with the condition to have the inclusion and have the quality life that they merit. It's not of their making that they have to live with dementia. Of course, they will have to live with it for the rest of life to whatever extent. And it will be useful and fruitful if the community can understand what the condition is. Listeners, I will be presenting more on different aspects of the condition as we unfold. Watch forward for more presentations in my videos. Thank you for watching and look forward. Subscribe if you have not done so in order not to miss any of my presentations in subsequent sessions. Thank you.